Good morning, Bob Ravenscroft here for our February 2nd media briefing. It is media briefing number 123. So with our pledge from long ago to stay transparent and open with you, we're back again today to report some numbers on COVID patients, which are thankfully declining, as you know. A little bit of update on our testing, and then we'll open it up to any questions. Very busy here at Bryan. We have 502 patients as of midnight. Thankfully, our COVID numbers continue to decrease, and it is just such a positive news and a wonderful situation. Let's keep this going as a community. Right now, for COVID patients that are in the hospital, we have 45 patients total. 34 of them are positive, and 11 of them are no longer positive, but still receiving care. As far as levels of care, you can see on the slide that only 3 of these patients are currently on ventilators, with 5 in our intensive care unit, 17 in progressive care, and 23 in general care. When you look at it by county, essentially 2/3 of our patients are from right here in Lancaster County, and you can see the map of the state of Nebraska clearing up, continuing to clear up, so that is positive. And as we've all been reading, there's a fair amount of vaccination out in rural Nebraska, so let's hope people are taking it, continuing to practice safety measures, and let's keep that down. Just real quickly on vaccinations, at Bryan now we have administered 10,249 vaccinations. That includes people who have received both their first and second dose. So right now, we have 3,555 employees that have received their second dose, and 989 clinical staff and providers. So it's gone excellent. It's been very efficient. And as you've heard from us, we've turned our attention to providing some volunteer support for the Pinnacle Bank community vaccinations. I would just encourage you that as this looks like it's beginning to, shift into a different season where it's all about vaccinations, we do not have the ability to buy vaccination. We are not getting reallocated additional vaccination beyond what will be needed in the future for new hires. It is all being controlled by the feds, then the state, and then the regional health departments. However, bryanhealth.com, there is a vaccination resource page where we are linking to every possible resource out there for the public if they want to use that for learning where to go. Our team's staying up on all of the activities of the city and posting relevant information as it comes. With that, again, this is briefing 123. We're going into the season of vaccination. So we are considering backing these down to once a week and just sending out the written reports. But we would like to hear from members of the media directly. Let Brad know what day might work best. I know you have other obligations covering this topic, from either things the mayor is doing or the governor is doing. So if there's a recommended day that you think we should consider for a once a week touch base, that'd be great. But what that also means is we're here and available to set up one-on-one interviews in a way that we couldn't do earlier. So we'll open that up. So no decision made on the day yet. We'd really like the media's feedback. And then I guess some of our public, if you have day preferences, go ahead and shoot those through Facebook as well.